doing, but I do think that the rationale is there. Thank you.
Thank you. Senator Wolf?
Thank you. I will try and be brief. Senator Monning, I've supported your bill the last time and previous incarnations of this bill. At the time that I gave you that vote, I told you that I didn't like the issue of the point of purchase and everything to do with the anything that has to do around vending machines or the point of purchase. I just thought that that was a problem, and you agreed last time to take a look at that and give that another look. I have to tell you, Liz Applegate is a heroine of mine. Yes. She is loved and beloved at UC Davis and in the city of Davis, and is a phenomenal teacher and a good advisor on lots of things. So I was very shocked to see you. So I listened carefully to what you said. I want to ask you a question. I assume, or maybe I should ask you, I assume that you are supportive of the listing of calories on menus and, purchases of products and fast food stores and all that.
Absolutely am. In fact, front and center on packaging. And the new food label that's due out sometime soon will make calorie font size bigger.
Good idea. I see this. Tell me then why a label that simply says that drinking beverages with added sugar contributes to tooth decay, to obesity, to diabetes, doesn't fall into that same notice category.
I look at that warnings label as being misguiding to consumers, because then they reach for a coffee drink that has actually more sugar than that sweetened beverage. They reach for other things that do not fall within the category of sugared sweetened beverages and are consuming more calories. I don't agree that sugar is the driving force behind diabetes. I don't agree with some of the statements that were made. It is so important to look at exercise and activity. To me, a warning label on TV screens and tablets would be much more effective. Warning, using this for more than an hour in a row is connected to childhood obesity, teen obesity, and adult obesity. Who's going to go for that? Nobody, right? So we find something really quick, and I think that is not right and not fair for consumers and really is not educating them. Insulin resistance, #1 treatment to improve insulin sensitivity is exercise, not cutting sugar out of the diet. I don't agree that people should eat a lot of added sugar, don't get me wrong. But I think we need to really take the time, and I agree with Senator Mitchell, address the obesity and diabetes situation with a comprehensive approach. It's going to take some hard work. It's going to take the community getting involved, building fitness places and safe communities for exercise, but putting a label is not going to do it. We're not educating consumers. They're going to reach for something else.
Well, I'm going to have to disagree with you. I think I would like to see the other labels that you talked about as well. I agree with you about the iPads and things of that nature. I agree with you about, in fact, there's not much I disagree with you on, except this bill. So I will be supporting this bill. Thanks. Glad to see you.
Any other comments? Do we have a motion? Oh, Senator Mitchell moved it. Is that correct?
Yes.
Yeah. So we have a motion by Senator Mitchell. Would you like to close, Senator Money?
Yes. Thank you, Mr. Chair. And again, all of the committee and everyone who's pitched in today in support or in opposition, you've been generous with your time. I do want to offer a brief close that just addresses some of the information that's been put out today. The suggestion that all calories are equal is just not accurate. All calories are not equal. Many in the sugar-sweetened beverages are empty calories that are proven to do damage. The testimony from Dr. Applegate on behalf of the American Beverage Association is important, I think, to understand, because you've received a letter of support from the California Dietetic Association with 7,000 registered dietitians and nutritionists who are in support of SB 203. We're talking about informed choice. The opponents have argued that, well, these are just treats and consumption has gone down. First of all, one 20 fluid ounce bottle a day increases a child's risk for obesity and preventable diabetes. The marketing of these products cannot be forgotten, and that's why we're going to the point of marketing to ask for a warning label that puts what science has agreed to be the potential adverse impacts, the known adverse impacts of these products, to inform choice. The marketing of these products, the liter bottle of a sugar-sweetened beverage, its product placement in supermarkets at eye level, when you walk in the store, when you come up to the checkout stand, priced less than an equivalent amount of milk or water. That advertising extends to 24/7, around-the-clock advertising on television, on social media, on billboards, and targeting particularly at-risk communities. So we can have a factual statement that consumption is going down when in other communities consumption is going up because of the focused, targeted marketing, and that's where we see the proven adverse health impacts. Quite simply, members, you've heard from a long list of supporters from the American Heart Association to recognized physician, scientist, researchers. Do you want to today take the word of the American Beverage Association or the American Heart Association? And the list goes on and on and on. I'm the first to acknowledge, as Senator Mitchell did, this is not the solution. The solution, the problem is complex. The health epidemic continues to grow, and this is a tool of providing information that can help inform families in the choice they make for their children. I'll just close with this, Mr. Chair. The two counties I represent and a neighboring county, San Benito County, Monterey, and Santa Cruz, the public health officers completed a public health study of children in the region that I represent. They found that over half of the children had had a soda in the last 24 hours, but they had not had water. Over half. And that the acceleration of preventable diabetes in every Senate member's district is on the rise. There is not a Senate district in the state of California that child obesity leading to preventable diabetes is not on the rise, and that we know sugar-sweetened beverages are the single leading contributor to increased bad calorie intake. Members, I know the power of the opposition. You each know the power of the opposition. We take an oath to do what we think is best for the health and safety of the people that we represent. I believe a yes vote on SB 203 is a vote to protect the health and safety of the people we represent. Mr. Chair, I would request an aye vote, and members, thank you.
Thank you. This is item number 5, SB 203, due pass to appropriations. Call the members.
Hernandez. Nguyen. Hall. Mitchell. Mitchell, I. Monning.
Aye.
Monning, I. Nielsen. Nielsen, no. Pan. Pan, I. Roth. Wolk. Wolk, I.
Currently has 4. We'll place that bill on call. Let's move to your item number 7, SB 315, and that is Healthcare Access Demonstration Project grants. Please proceed.
Thanks. Thank you, Mr. Chair, members. I'd like to begin by accepting the suggested amendments as stated in the committee analysis relating to the program reporting requirements. Members, Senate Bill 315 authorizes the California Health Facilities Financing Authority, sometimes referred to as CHIFA, to transfer up to $1.5 million from its Hospital Equipment Loan Program Fund for use in a second California Health Access Model Program, or CHAMP-2, competitive grant selection process. If the demonstration projects receiving the CHAMP grant are deemed successful, then SB 315 would additionally authorize up to $5 million to award grants statewide to replicate and implement innovative models. Any authorized but unused grant funds as of January 1st, 2023 will revert back to the original fund. The first CHAMP grant has had preliminary success and sparked other innovative ways to promote innovative healthcare delivery for vulnerable populations. This bill seeks to build off that success with a second round of CHAMP grants from Chief of Funds that have accumulated due to loan repayments and the building of interest. The second round of CHAMP grants that SB 315 will enable have the potential to increase health access, improve clinical outcomes, achieve cost savings in the healthcare system, and yes, address the growing epidemics in our community of obesity and preventable diabetes. Sponsoring this bill and here to testify in support, I have witnesses. Mr. Chair, with your permission, would like to present the witnesses in support.
Thank you. We do have 6 minutes for support and opposition. Let me note that there is no opposition.
Good evening, Chair and members. My name is Adriana Zario on behalf of State Treasurer John Chung. We're the sponsors. Based on the success of the first CHAMP, we believe that CHAMP 2 will continue to find creative and innovative ways to improve health access and cost containment objectives in an effort to meet the growing healthcare needs of our state. I have with me Carolyn Abu-Bashara from CHAFA if you have any technical questions on the program. Thank you.
Mr. Chair, member Stephanie Roberson on behalf of the California Nurses Association really appreciate the first and second effort by Senator Monti and Senator Hernandez on this. We work very hard to ensure that vulnerable populations, folks in need of health care, projects, obesity, and all those types of prevention issues can be addressed. These necessary funds seek to address those issues in a very innovative way. We appreciate the collaboration on this and support the bill. Thank you very much.
Chairman and members, Barbara Glazer on behalf of the California Hospital Association. We too are here in support today. We were supportive of the original program and would like to see it continue.
Thank you. Anyone else in support, opposition, questions, comments? Yes, Senator Pan.
Just briefly, again, I think it's a great bill, and actually, if there's an opportunity, I'd love to be added as a co-author.
Great, thank you.
Thank you. Seeing no other comments, any motion? Is there a motion? Moved by Senator Pan. This is item number 7, SB 315.
Mr. Chair, I also, in closing and respect to action I vote, I just want to acknowledge your joint authorship of this measure, and I've enjoyed working together with you on this. Thank you.
Would you like to close?
That's my close. Respect to Ashmere, I
very
vote.
much.
Thank you.
Item number 7, SB 315, do pass as amended appropriations. Call the members.
Hernandez?
Aye.
Hernandez, aye. Nguyen? Nguyen, aye. Hall? Mitchell? Mitchell, aye. Monning?
Aye.
Monning, aye. Nielsen? Nielsen, no. Pan? Pan, aye. Roth? Wolk?
That currently has 5. We're going to place that bill on call, and we're going to go to Senator Pan, has item number 17 and number 19. Then we'll go to Senator Mitchell after that. Well, I'm going to make you go second to last because I should make you go. I'm going to make you go. I should.
Okay. All right. Okay. All right, thank
Okay,
you.
we're item number 17, Medi-Cal Ground Emergency Medical
Yes.
Transportation Services. Please proceed.
Thank you, Chair Hernandez and members. I'd like to first start off by thanking the chair and the staff for working with my office on this bill. In front of you, you should have a mock-up of an amendment we plan to take regarding the date of implementation, which has been delayed. I am here today to present SB 534, a measure that will help our local governments offset some of the costs for providing emergency medical transport services to Medi-Cal enrollees. Medi-Cal reimbursement rates for ambulance services, much like rates for other provider services such as government hospitals, nursing facilities, mental health programs, clinics, and physician services, have not kept pace with the actual cost of providing the service. However, these other programs are currently drawing down nearly $400 million per year in federal reimbursement funding for local and state providers. The only group of government providers not included in the program is ambulances. SB 534 is modeled after supplemental reimbursement programs designed for these other providers of services to Medi-Cal beneficiaries to obtain increased federal financial participation. SB 534 would allow local government entities to claim federal financial participation utilizing certified public expenditures, or CPEs. CPEs have proven to be popular and successful mechanism for obtaining federal financial participation without impacting the state's general fund. So here with me to testify in support of the bill are Christy Boma with the California Professional Firefighters and Scott Clough with the Sacramento Metro Fire Department. Thank you.
We do have support on both sides of the aisle, no opposition. I would appreciate if we can make it brief.
Mr. Chairman, members of the committee, Christy Bauma representing the California Professional Firefighters, pleased to be co-sponsors of this measure. This author and this body approved the CPE program that is in operation, but not seeing dwindling resources due to the migration to managed care in Medi-Cal. We urge your support.
Johan Claes, representing Paramedics Plus, Alameda County's 911 EMS ambulance provider. We strongly support this bill. It provides some great opportunities to deal with the problems of Medi-Cal reimbursement in the future.
Scott Clough, representing Cal Chiefs as well as California State Firefighters, and I will be brief. Thank you very much, and I appreciate an aye vote.
Ted Peterson, Novato Fire, representing Cal Chiefs. We appreciate your support, and I vote.
Thank you very much. Opposition? Questions? Comments? Is there a motion? Moved by Senator Wolk. Would you like to close?
Respectfully ask for an aye vote. Thank you.
Item number 17, SB 534, do pass as amended to appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Wynn. Wynn, aye. Hall. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan.
Aye.
Pan, aye. Roth. Wolk. Wolk, aye.
That currently has 7. We're going to place that bill on call. Item number 19, SB 591, cigarette and tobacco product taxes, California Tobacco Tax Act 2015. Please proceed.
Thank you again, Chair Hernandez and members. SB 591 proposes a new $2 per pack tobacco tax on tobacco products to save the lives of Californians suffering from deadly and preventable diseases, and to also help prevent more youth from using tobacco in the first place. Tobacco use is the single most preventable cause of death and disease in California, claiming the lives of nearly 40,000 people every year. California has approximately 3.6 million adult smokers and over 220,000 youth smokers. African Americans, the LGBT community, and low-income Californians smoke at disproportionately higher rates than the general population as a whole. Treatment of cancer, heart disease, and stroke, lung disease, diabetes, and other diseases related to tobacco use continues to impose a significant burden on California's healthcare system. Smoking-related diseases cost our state roughly $13.29 billion in medical expenses each year. Almost $3 billion are taxpayer dollars used to treat Medi-Cal patients with tobacco-related illnesses. In addition, the cost of lost productivity due to tobacco use is estimated at another $10.35 billion annually. Now, California has not increased its tobacco tax since 1998, and at 87 cents per pack, currently ranks 33rd in the nation for tobacco tax rates, below that of Texas. 18 other states have tobacco taxes proposed in 2015, but their passage won't be easy. Last year, Big Tobacco killed 22 attempts to raise tobacco taxes across America. Increasing the cost of tobacco is widely recognized as the most effective way to reduce smoking across California, particularly initiation of smoking by young people. The tobacco industry knows this, which is why they're spending millions to try to stop us from despite the obvious benefits to society. A $2 per pack package increase will generate $1.5 billion in revenue in the first year alone. Some of the funds raised by SB 591 will increase the capacity of proven statewide prevention and education program to reach adults and youth alike through media, schools, and workplaces. And SB 591 will provide much-needed revenue to improve access to health care for low-income Californian families and individuals, including treatment of cancer, heart disease, stroke, lung disease, and other diseases related to tobacco use. SB 591 will also expand frontline law enforcement programs to prevent underage sales and tobacco tax evasion. I have respectfully asked for an aye vote, and I have witnesses in support.
Thank you. Please proceed.
Alicia Sanchez, representing the California Medical Association. We're a co-sponsor of this legislation, and Dr. Payne really provided a very comprehensive statement, but I would note that our members are really on the front lines of dealing with the preventable diseases that are related to tobacco use, from cancer to chronic bronchitis, emphysema, cardiovascular disease. And while there's a lot that our members can do in a clinical setting to treat these diseases, prevention is paramount. Look at lung cancer, for example. The 5-year survival rate for lung cancer, which smoking accounts for the majority of lung cancer cases, is only 17%. So once that is diagnosed, there's only so much that a physician can do. And so we are very supportive of the increase in the tobacco tax because it will decrease smoking rates in California, and we urge your support today.
Thank you. Please proceed.
Good evening, Kimberly Amazine, representing the American Lung Association, California. It's our mission to save lives by improving. I will, that's okay, that was pretty funny. By improving lung health and preventing lung disease. And there's no greater return on investment in California than by raising the tobacco tax. We've seen a 20-year investment of raising that tobacco tax and putting some of that money into a proven and effective California Tobacco Control Program, which has saved over 1 million lives and $134 billion in healthcare costs. But we still have a significant number of smokers in California, 3.6 million and 200,000 youth. That is larger than the population of the state of Oregon. Investing in prevention, in proven programs, and investing in better access to help those vulnerable populations that need treatments to help them quit smoking is the best way to spend the tobacco tax, and we urge your aye vote today.
Thank you. Please
Mr.
proceed.
Chairman, Senators, Terry Brennan on behalf of SEIU California, we're the largest union of healthcare workers on the front line of treating tobacco-related diseases up and down the state. This bill gives you an opportunity to vote, in your case twice, Chairman, for an opportunity to save lives, prevent kids from starting smoking, invest in cancer research for cancer prevention in the future, invest in anti-smuggling programs, and then create a fund that has the potential to draw down somewhere between $2 and $3 billion when you include federal matching funds for the treatment of cancer-related disease in our poorest communities. For that reason, we urge your aye vote.
Thank you. Anyone else in support? Please name and position.
Tam Ma with Health Access California in strong support.
Jerry Jeffy, California Chronic Care Coalition, support.
Sandra Poole, California Black Health Network, strong support.
Lynn Silver, Public Health Institute, passionately supportive.
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Brian Warren with the California Pharmacists Association in support.
David Ford for the Association of Northern California Oncologists and the Medical Oncology Association of Southern California in support.
Brianna Pittman with the California Dental Association in support.
Christina Romero, Planned Parenthood Affiliates of California in support.
Tim Gibbs, American Cancer Society Cancer Action Network, proud co-sponsor.
Kula Koenig, American Heart and American Stroke Association, proud co-sponsors.
Teresa Stark with Kaiser Permanente in strong support.
Jody Hicks with the California Academy of Family Physicians in support.
Opposition?
Mr. Chair and committee members, Jennifer Brewer on behalf of the California Chamber of Commerce, and we are opposed to this measure. I appreciate that the jurisdiction of this committee is to look at the health issues, and why we are not opposed, obviously, to research into cancer and trying to resolve these medical issues. We are concerned with the revenue source for this being a targeted tax on one particular industry to bear the burden of this. This industry has already shown to be a declining source of revenue, as illustrated in the budget every single year, and to put more emphasis on this revenue source as a declining source to fund these new and additional programs, we do not believe is the appropriate way in which to fund these programs or the research. Additionally, we are concerned with the activity this would have with regards to the black market, which the Board of Equalization is already having a difficult time in addressing, and so for those reasons, we are opposed.
Thank you. Any questions from the members, comments? We have a motion to move the bill by Senator Wolk. I want to commend the author for bringing this bill forward. I'm very supportive. Would you like to close?
Yes, thank you. Just then, quick response to the opposition about this being a targeted revenue source. I will say, unfortunately, the product in which we are addressing also is a targeted cost as well, because it's generating $3 billion in taxpayer dollars to treat the impact, as well as, of course, to the larger economy, $13.29 billion in medical expenses. So I think it's very appropriate to do that. This bill is part of a package. I appreciate the support from the chair and his work also in terms of trying to address this major public health problem as well. I respectfully ask for an aye vote.
Thank you. This is item number 19, SB 591, to pass to appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. No. Nguyen, no. Hall. Mitchell. Aye. Mitchell, aye. Monning. Monning, aye. Nielsen. Nielsen, no. Pan.
Aye.
Pan, aye. Roth. Wolk. Wolk, aye.
That currently has 5, and we'll place that bill on call.